In the heart of Wulutorha in Kolahun district lies a community determined to build a healthy future, Quessemba town. For years, Quessemba Community Clinic has served as a lifeline, bringing hope, healing, and care for hundreds of families. As Liberia makes its 179 years independence celebration, Quessemba Community Clinic is giving back to the people through a special 4 days medical at from Wednesday, July 22nd to Saturday, July 25th, 2026. Residents were invited to access affordable healthcare service. They ensure that both adults and children receive essential medical attention.
We've been doing medical outreaches here, as someone who, moved by compassion to always help. We always look for a way that we can serve the people. We look for a way to empower them. If the people have good health, they are in good health, they can go ahead with their farming job, which is their livelihood, and then they'll be able to help themselves, sustain themselves. So having good health is key. Promoting good health is very paramount to what we stand for. Therefore, we've been doing outreaches. This was just one of those moments you think about, oh, this big day is coming. Man, what can we do to celebrate? What can we do? We way out here at the back of nowhere. If you look at it, this near Kolahun this way, this Vanjama, we are right at the corner of the triangle, and then we got Guinea right here, the Makona River. So the like 5-minute walk from the river. So we got Guinea right here, we got Vanjama here, and we got Kolahun. So we just thought, usually, when this whole border thing was not an issue, usually independence celebration, our Guinean brothers, sisters, they will come over to celebrate with us. We are giving back for the independence to say, look, this is Liberia's big day or biggest day, Independence Day. So what can we do to give back to our people? The whole idea is just to share, but normally our medical outreaches come twice a year. We do it in November, then we do it in March or April. So usually those are our medical outreaches period. We've been doing this 2020, 2024, 2025, we've been doing outreaches. But this one was just like our clinical staff, just at the clinic. When we're doing a bigger outreach, we usually have doctors that come from the States, from Moravia, from here. Sometimes we get visit from, Telewanya. Dr. Sa visited us the last outreach, if I remember correctly. So this one is just us trying to share with the community for the independent. That's why we made it reduce cost. Our cost is already very low. 1 serving for adults for treatment, then about 800 or 1,000 for children. That's normal price for checkup, medication, all that. So we just decided to make it lower or more, so that people can afford it, and also come and say, oh yeah, Independence Day, they made it really cheap for us to check ourselves. So we just want to encourage them. Rainy season, all kinds of sicknesses can pop up, so to encourage them to come and get checkup and get treatment. And we really have, based on the report I got from the clinicians, we really have some critical cases. When you have outreaches like this in the rainy season, where most of the time people are concerned about how they can get their food, this and that, and then you got a big day that day people concerned about maybe what they will wear, what their children wear, what they will eat, and then you have people coming. That means it's very serious, because in most cases they will put it off, they will postpone it and say, wait, that'll be serious. So the cases we saw, they were people that needed attention. You know, we provided everything that has to do with primary care, you know, preventive care as well, or secondary care, where they treated the expectation that people would not sit, the condition gets worse. You know, where maybe small facility like this can no longer help you. You have to go to bigger places and spend more money. The expectation is that we'll make healthcare accessible to our people. We'll make healthcare affordable to our people. The expectation that they will come. You know, those who need the services, that they will come. So this is what we did everything possible to lower the cost. We did everything possible to also bring the right medications, the right test. Then we will, by the grace of God, we thank God for the wonderful staff we have. You know, we got people who are producing great results. We got people producing great results, seeing patients, giving the right diagnosis, and also the right treatment. So we just want to say thank God for that. So we expect to have a community where people are in good health to carry on their farming activities. Most of them are farmers, some are business people, cross-border trading, especially Liberia game. And this clinic is not just for Quessemba town, you know, Quessemba. In Bandi is Wahimba. That's why when you Google, you see Wahimba, because in Kolahun district, predominantly Bandi. So in Bandi is Wahimba, but Kisi pronounce it Quessemba. So Quessemba take preeminence over the Bandi. It's in Quessemba town, but we serve people from far because the reputation the clinic has built prior to even having the clinic. We started having medical outreaches, bringing the doctors. So we created that where we bring doctors and medicine. In fact, the first outreach was free. Then the next outreach was at $200 LD. Yeah, that's how I remember. Then the other outreach became $500. Then another outreach we went to $1,000. Yeah, as I said, in order to boost the operations of the clinic, since we already used to do outreaches twice a year, or you know, so now even though the clinic is here, the turnout is not like before, because the clinic is here. People are no longer like sitting, waiting and say, oh, let the big doctors come. Now they can come to the clinic, and the clinic has saved lives, so many lives, right? But now we still try to keep the medical outreaches at least, you know, or at most twice a year, because the clinic is running. But when we can get the doctors to come, we'll try to do it twice a year. We just had one March, this past March, right? And we'll try to keep it in dry season. The reason it's easier for people to commute. Then two, also dry season, people can have some cash they can afford to pay, compared to the rainy season where they worry about feeding their family, you know. So we just had one in March. We already got one. In fact, the other doctor from the States already bought his ticket coming in November. Most people here know him. By then say, oh, the American doctor, Dr. Sikra. So Dr. Sikra already bought his ticket coming for the medical outreach. My wife too already told me she's a medical doctor, ERWA, Dr. Koha. She also already said, I'm going to look at my schedule and see how I can be there too, So then we got Dr. Sa to Telewanya there, who also will be talking with. So we already got Dr. Secretary Boys together. So the next outreach will be in November, middle of November to like the first or second week in December rather. So Quessemba Community Clinic is birthed from the idea that we just want to help our people. We just want to bring healthcare to your door. We just want to make it accessible to you, and we also want to make it affordable, cheap for you to come to. We know it's not easy. Healthcare is not cheap. It's not cheap. So if you go to whether government places, private places, and they're charging you, and you say, oh, no, for you to get healthcare is not cheap anywhere, except if the government or NGO intervene and say, let's just help to make it affordable. So healthcare, good healthcare especially, is not cheap. So if we can try our best to bring this, and we're providing quality services, we're bringing you good medication, please take advantage of it. That's the purpose. Quessemba community is in a very remote area, remote part of Liberia. We praise God that recently the government, in partnership with IFAD, did this road connecting us from here to Kolahun Road Junction, the road that goes from Vonjamado to Foya. So now we have access this way to go this way. But before, we never had this road. Then it was this road from Vonjama coming through Lawalazu, come through Samita, Tumbugezu town, and you come here last. It was this road we're using. And this road is very, very, very terrible. From Vonjama to Lawalazu, Tumbugezu, Quessemba, you walk there today, you can throw more light. It's bad for motorbike, it's bad for vehicles, so. But we've been here helping ourselves. We never had school here before. Like I told you before, I used to walk from here to the other village as a little boy. Used to go with an elderly guy, and we used to cross that river. I still remember it, and going back and forth. Then later moved that way. So. But a few years ago, a little girl got drowned in that same big river that in the rainy season. It gets bigger. Dry season, you see it like a little creek, right? But in the rainy season, it covers bigger area. But so a little girl got swept away by the river current, and I was in the city, I heard that. I said no. When I was there, I walked that distance. We can't continue having our children walking that distance. There were no cars, so it was just a narrow footpath that they were walking, So you can't continue having children, and then they go and cross the river. So we decided let's put a school up. So we help ourselves. We initiated, we help ourselves. Then we talked to one or two good people back then who also gave us, some contributions. And I would say the former Chief Justice, the former Chief Justice, Honorable Kokbo, help us with our school. Even the former lawmaker, Honorable Clara Masakwe, also help us in our school project. Then we help ourselves. We help ourselves to build it, but they give us a hand, some helping hand. Then we decided the school is not enough. Let's go to the clinic, because the way people were dying around here, people were suffering. In fact, the big better, I would say, pregnant women, big better. They had to walk. When the person gets in delivery, they will have to like take the person or walk with them to the next. Imagine someone is in delivery pain, right?
Yeah.
They having all that pain, then you say walk and climb all the hills. You saw the road, or go this distance. So some of them were giving birth on the road, from what I was told. So that happened. So we decided, let's put up a clinic, and we did that. And in putting the clinic, we also had some good people that came in to help Dr. Musoka Fala and his organization called Refuge Place International. He helped my own former dean of student, Dr. Shirley, who's in the States. He was very helpful. Then Dr. Sikra now, who is involved with us. Then the community you see here. That's why I love being with you. Saw, right, the meeting?
Yeah.
You were here, you saw the meeting. It's just to have the 26th celebration. They collected small thing to prepare for 26th celebration tomorrow, even though it's today, Independence Day. But tomorrow, plan to have a little party, eat together. So the community also, we help ourselves, because the sons and daughters of this town in Moravia form an organization called Quessemba Town Citizens Association. We contribute. We have a leadership there. I was a leader for that association for 8 years, and decided to step aside to allow people to take over after taking it from the formative stage, putting everything in place, and initiating some of these projects. Then I decided, let the others continue. I'll be there as advisor. So I'm advisor. They use me also for project. So right now there are other projects on our table. We're doing an annex at the clinic. You saw the annex at roofing level, and we need some help with that. Whatever we can get to complete the annex. The annex will have the dental. We plan to have an x-ray, possible we can get that, but we have room already. We have lab, the laboratory. Right now we're using one room at the clinic, which really is supposed to be screening room, and we don't even have a full lab set up yet. So the annex now will have the full lab set up, and then we'll try to have like little some storeroom there. So in fact, there'll be an area there for art services as well. So the annex is already at the point where we need to go to the next phase, roofing, and we need some help, zinc, nails, the planks. So it's sitting there. Then as a community, we don't have a town hall. There's a little town hall I told you about in the center. I remember when I was small. That was the town hall. So imagine. Then when we brought the clinic stuff, by the grace of God, we were able to get 40-foot container that came with all the clinic, furniture, supplies, other equipment, right? So we had to keep some in a small town hall as a warehouse. When we complete the annex, then we'll move some, over there. And so we can clear it. But still, the town hall is very small now. Therefore, we started a project. When you go in front of to the football field, you'll see the foundation already there with the profile, everything laid for, the picture of the town hall is there, so the architecture picture now. So we got town hall in the making or in progress, but it's waiting until we get done with the clinic annex. So we got the next will be after the town hall, will be taking on the market building. So we don't have a market building. The people here, they are the border, and what goes here is border trading. So it's good to have a market somewhere right by the border. When they get their produce from the farms, sometimes it's a big distance or it's long distance for them. It's a big deal to go to Vanjaman, Kolahun. So sometimes they do border trading. When things are normal, it's cross-border trade. So we got the clinic annex, we got the town hall, and then we plan to do a market building. And the last that was in my plan, the leadership now continuing some of what I had, my blueprint, right? So it was school, clinic, town hall, market, and guest house. So I left that blueprint. So it's continuing, we're continuing on it. Even though I'm not in leadership, but the current leadership also continuing there. On the plan. So now we need a guest house. The town, as a community, we don't have a guest house where you got some important guests come to you and say, oh, there's the town guest house. No, we don't have it. So we need that. Like I said, we fight to do our own, but when we get that we're doing this, perhaps someone will see and say, look, we want to help. How can we get involved? And everything we do here, the community is informed. The leadership, you saw the whole leadership. Okay, so everything we open to them. The town leadership is here. Then the citizen association outside the town leadership in Monrovia. So we got two leaderships set up, and we work together. The citizen association in Monrovia, they have president, vice president, secretary, treasurer, cheerleader. Then the town, they have town chief, deputy town chief, secretary, cheerleader as well. Then they have the youth leader, So everything we do together, we plan together, we coordinate. We don't take something from America and force it in their throat. We share with them, and they too share, and we come together, we find support. We contribute what they can get, like zinc, whatever. They will do the labor, the molding bricks, getting the sand, looking for whatever we can get here, then we have to buy. Right? So they will do like this town hall now. We have committed in Monrovia, we have committed to providing 200,000 LD, the association, 200,000 LD. By the rate we took then, it was supposed to be like $1,000 US. But that's not enough to do that town hall. So there too, the youth here, they are now doing contracts. They do every Saturday, they take contract out to people's farms. Sometimes they go to other villages, they will take contract to raise money and keep it. That's how we did with our school. When it came to roofing, we didn't have much money, what the carpenters were charging us. So the youth here, they took contract everywhere and raised almost 100,000 LD plus to pay. So we help ourselves. We collaborate, we work as a team. Lofa, right? In this country, Liberia as a whole, we eat a lot of rice as a staple food, right? But Lofa, particularly, to eat other food sometimes is a little bit difficult for them. Rice. And at some point when I started doing the cassava, they took it like I was just wasting my time, my money. Say, cassava. What? Even my mom, as old as she is now, she's in the house. She always, You just wasting, throwing your money in the ground behind the cassava. You can't leave the cassava business. So, but I felt like, you know, I mean, I'm not an agriculturist, you know, it's not my field, but knowing a little bit about cassava, you know, it got a lot of value. You can use it for so many things, but let's just say the leaves, right? We eat the leaves, cassava leaves. One of the best soup you can get from Liberia, Sierra Leone, cassava leaves. Cassava leaf soup, one of the favorite. So we got the leaf. Then we got the cassava itself that you can cook different ways. You know, you can make it to swallow. You know, you can do it just boil it, cook it nicely. Do it. You have your gravy and eat it with it. But I just felt like seeing our area now, our land. We don't have much forest. We don't have much now compared to when I was growing up here. Moreover, you got Nyenemwela town this way. They also are growing. So the bush is getting scarce. The farming area is getting scarce. In fact, many of them here now, they hardly get much rice on the farm. They don't get much rice from the highland farming. They all complain. What even blessing them to have some rice here is the swamps. The swamp that they have around. That's what blessing them. So I decided to kind of like, I'm not a farmer, but I said, let me just have farm. And what do I said, I don't want rice. I want to focus on other things like cassava. So I decided to do just cassava, which is easy to grow and easy to manage. You know, you brush on it and then it grows fine, it produces. So even when we're having medical outreaches, at some point we used to have so many patients. All the houses will be full. The people houses will be full, and the patient will come from different towns, villages, Guinea, Liberia, and they have nowhere to sleep. So they'll have to lodge with people in town here. And then those families have to feed them. It became a very big challenge. You see hundreds of people at the clinic to see the doctor, serious cases. So sometimes you just feel so bad that the citizen, the weight was getting on them. You know, sometimes it'll be relatives, sometimes it'll just be like connection to say, oh, when you go over there, ask for this person. So the weight needs to be on them to feed the people, to host the people and feed them. You know, even though we just say when you come in, bring your own feeding, but they will still come with nothing. So, and you can't look at, you know, and say, no, I can't lodge you, I can't feed you. So my cassava needs to come in handy. Helpful. So I just need to tell you, go and take some cassava and feed the people. When I was planting, to be honest, my mind never ran on that would have medical outreach and it will be useful for that. I just decided to grow it to see if I can show them an alternative, you know, cash crop. But the challenge is the goal is that we could be producing gari, or what we call farina. We could be producing gari, right? And that's the goal. I don't have a gari machine right now. But if I can get a machine and can produce more gari, that will even be more helpful, because now they can put sugar, milk, eat it. They can do it like in a way, put some hot water, fix it nice to swallow with soup or something, right? So the goal is to have, I want to have a gari machine produce that. But just the raw cassava, very useful during medical outreaches. Then even when there are no medical outreaches, now they can just go and get the leaves for soup. You know, but I'm doing it to encourage them to look at other things other than just rice. Some of them start, getting it now, but still not much. They're not too many inside. Now everybody doing cocoa and palm, cocoa palm. So I'm still doing cassava if you go down here or up the hill. But it's to encourage them to say, look, besides rice, you can grow pepper, you can grow bitter, but they will say, this thing don't grow well here. But the cassava is growing farm. It's growing very fine here. So it's to encourage them to have an alternative. When the roads are good, you can take the cassava to the market to sell. When there's gari machine, we can produce the gari, and people can use that to eat. They can use that to sell and get some money and buy other things. So that's why I decided to get into the cassava farm. It's been a challenge. I have to pay people to brush, I have to pay people to maintain it, and we gotta, so it be a challenge, and no profit coming yet.
Providing checkup across the board. We provide checkup for hepatitis B, for ulcer, and across the board, whatever problems you come with, we will provide checkup. After the checkup, we also provide the medication necessary for the treatment, for the sickness that you come with, and that can be given to you at the minimum cost of $1,200. Where from the past, this is our regular charges for here. Adult, you pay $1,700, and the children $500. But because of this medical outreach, we decided to give discount to our patient, and so we have for the past 3 days now, today making it 4 days, we have these charges of $1,200 and children $500. This is what we are doing as we observing the Independence Days. This is how we decided to give discount to our patient in order to help our people. As you may be aware, Quessemba Community Clinic is a non-profit making institution. It is for our own people help. For here, if you just spend 1 or 2, 3 hours here, you will see the kind of help this clinic is providing for people. Even though we got clinics around here, but you will always see those clinics referring patients to this place because we have sufficient drugs. We can tell you that even surrounding clinic here, at times we donate drugs to them. Even our referral hospitals, sometimes we send some equipment out there that we are now using if we have, only to make sure to help our people. Imagine today, if you go to other health facility, they will charge you $10,000, $15,000, $2,000, $15,000. Here, imagine we will charge you just $1,200 at this time we're having an outreach. So it will be a great help, because on medication, in fact, you carry home. Let's forget about the services. In fact, the services that happen to do the checkup, the kind of way people will serve you, let's forget about that. But even the medication you carrying, if you want to sell it to other places, you will even generate more than $2,000 out of the medicine you're getting from here, including the services the health care or the nurses are providing for you. Really, God is using this facility to help people. My advice is that do your regular checkup. Quessemba Community Clinic is open to checkup, treatment as well. But if maybe you don't know your health status, you want to come and know indeed what is happening with you, or how is it like. Normally you see people will be carrying sicknesses over 2 years. They don't really know what is embarrassing them, and know that the kind of food we eat sometimes increase blood level in our system, or sometimes reduce the blood. You don't even know. So if you are doing your regular checkup and knowing your status, it will help you. If there's any medication needed for that purpose, they will give it to you. So I'm encouraging the nearby community, as long as this is established here for the purpose of helping people, please don't sit down there. Don't wait until it gets worse on you. Come and do your checkup. after the checkup. If there's need to get medication, don't worry, the medication is available. We are not like maybe after the checkup we don't have this medicine, go and buy it. No, absolutely, we provide the medication necessary for the kind of sickness you would come.
This facility then giving a lot of help to patients. That's in the case of diabetes, because no matter how you are a good worker, there are tools that make you to be a good healthcare provider, and which we have. So we have been helping people in this way by doing checkup for them, proper checkup, like confirming diabetes cases, both type 1 and type 2. And after that, what make you a good health worker? The medication, because if you don't have the drugs on hand, it will be hard for the patient. You have to give them the prescription to go and buy. While in the process of buying, maybe in a pharmacy or drugstore, someone who they told say, wait for me, I come in, the patient bother with them. Oh, it can do the same work, the patient will be at risk. For Quessemba Community Clinic, make sure, pray to God every day to provide the necessary medication for their patients that they confirming cases on, like insulin. Insulin is very expensive, but through the help of God, our administration can provide insulin, even though not for all patients, because insulin is $20 US for one vial. One of that bottle is $20 US, and the patient have to take insulin every day. Each time if they are about to eat, the patient have to take insulin. Insulin is a medication used for type 1 diabetes. So Quessemba Community Clinic try its possible best, even now for all patients, but at least to provide low expensive drugs which patient come and pay less money.
We do ultrasound here. If the pregnant woman can, the baby is not laying good, the ultrasound can help us to detect whether the baby is laying good or the baby is not laying good. And also to tell the baby better, the ANC vision, we can detect whether la twins or la only one babies in a person's stomach. The machine can tell us. And also we can cancel that the ANC visit is more important. It can help you to know whether your baby is breathing good or your baby is not breathing good. So we can cancel the baby better. The ANC visit is very much important for the baby better. Every month you're supposed to go for your ANC visit.
And we are here ready to save life, because when you call yourself nurse, you are there to save life. You are not there to harm anybody. So we are here to work for people, the citizen, and we are not just working for Liberian people alone. When you call yourself nurse, you can work for any other person. Any other person that come from any other area, you able to do something for them good, and they will be successful. So we are here as nurses, or I'm here as one of the nurses that really helping people to be successful in their treatment. And we are running things here, or we are doing a whole lot of services here. Like we do lab here that really cost cheap money. Sometimes some people come here, they really need hospital care, and we can also be able to talk to that person, counsel them. You know, some people they having the mind of then just come in and take their medication and go. Sometimes you are coming as a patient, you don't know your problem. So after diagnosing that person and we get to know that person really need hospital care.
We give vaccine to children from at birth. So now you give birth, we start giving vaccine. Polio 0, BCG vaccine can help the child avoid past sicknesses. It help the child. The oral polio vaccine help the child to not get polio, to not get crippled, and the BCG vaccine help the child also. Then we'll give 14 vaccine to give to the child, and it will help the child to get oral polio, BCG, RPV vaccine, OPV vaccine, and then we'll get Rota, get many vaccines that we can give to the children. It will help them.
COVID after the outreach, normal clinic fees will remain. However, the clinic remains open to serve the community, including emergency cases during and after the independence celebration.
Sometimes we go to Yenemola home, they stay far, so now they are very happy for Quessemba Clinic. They are very happy for Quessemba Clinic. Now we are closer to them. They can come here sometimes. They can't spend whole day. They go by. They go do their normal day work to their bureau home. So they are happy. We ourselves, we used to take people to carry them in Hammer into Bugesu sometimes in the Molahu, one Jama, put them on motorboat, but now we are happy. We're not taking it in Hammer, we're not doing anything now.
We will not get clean. We used to suffer, somebody gets sick, we used to take patients, carry in the Molahu, carry to Bugesu, this is the Ponyama, if it's small sickness, they will not have nothing here like clinic. But today, when somebody get clean, but it's small sickness, they are not taking steps, giving our help. No sickness can take steps to go out of town. You can get our help. Your hair things there, you go there, you get tablet, you get good treatment. Before we're not having that one there, but today we're getting that one. And today again, that clinic giving our help because all the money is less. You get good treatment. You pay 1,500. You get good treatment. As a citizen, you pay 1,000. And before we're not having that one today again.
Quessemba people, and I thank God for Sedu because he's the one that bring that project there. And same day I start that project, there are people who have been giving all whatsoever they can get it there. Treatment, when they bring medicine to them, they like to issue all. When they take the medicine, they bring it to me. I present it to the clinic that or to Bugesu town. We attend God. I tell God, thank you for what Quessemba as people are doing. People are doing well. They're not living up. Anything they bring there, on the line of issue of medicine, they got to sell for. ORC can take it and bring it. ORC can take it and bring it. And when I take it again, I present it to ORC that into Bugesu. They carry it to the clinic and they will tell all, yeah, they clean it and they medicine what they brought. Enough for buying. That one they can tell a problem. Enough for buying. It's free. And they giving you free. That Quessemba people giving it. Even though government say that people will be issuing medicine, but it will be money. But the one that Quessemba people can give it, that one they can tell them that it will be free. And when I take it up, give it to them, ORC, I will tell him, I say the medicine is for the time that Quessemba people bring it. It's for the time, but it will be free. They will not issue the medicine with money. And the how they tell me and the how I carry the information to the ORC that it will be town. Give us help. Send they have been giving that medicine. Most of the people myself said, I've been taking that medicine, they can give me help. Because the last time I was hurting one of my slums, he walked into the clinic there. He take me, carry me to PNU in Bonyama. And now when I go to Quessemba, I get that medicine. Now my phone is free. Now I'm obtaining so and say this year.
In the land of cakes. Before, when the clinic were not here, the children used to get sick. I had to find their parents, pause the class, some of them, they get our signal, I can just, attract them right away. So I had to find their parents. But from the time the clinic are being built here, even the parents are not around. The moment I experience, child will go or whatever sign or symptom or sickness, I can easily just take them to the clinic, treat them. Later we bring the information to the parent. So I feel that the clinic, we purposely build here for this school. So I'm benefiting of it a lot. Actually, I have for my neighboring, towns, villages, and communities around all. Let me tell them that they come for treatment. We are very, grateful to God for this community clinic being built here. The citizens, they have a best decision to take for the clinic to be built here because it helps a lot. There are good equipment, that in this facility. And also they have good health worker, helping us. So those are around, even giving, the people can when you come, the people have a lot of checkup. When you come, some people say they give testimony. They have been going from place to place. When they hear they discover the signal that they're having. So I will carry the message wherever you're listening to me. It is real that they come for treatment. Quessemba Community Clinic is very helping. It's very helping. So I will encourage people, if you not feel punished, if you not feel weak, that they just come and try.
Quessemba Community Clinic bringing health closer to the people because a healthy community is a stronger community.